there's just so much.
You're listening to a Mamamia podcast.
Welcome to Well, Australian Women. This is your full body health check. I'm Claire Murphy, and I have now become a health info starting point for my entire family and friendship group.
And I'm Dr. Mariam, the GP and person you should actually be receiving medical advice from.
Don't ask me. Today, Mariam, we're facing a topic that is really not comfortable for a lot of us. And here at Mamamia, we are very careful when we talk about weight, and especially when we're talking about diets, everything around that, because we understand that we are in a position to influence people and we do not want to do the wrong thing by our audience. In saying that, we know that our health and weight are tied and we need to have this conversation. The problem is, if you're like me and have had a really long history with trying to speak to your doctors about weight and felt very shamed by it, have felt very much like I can't do this on my own, but no one will help me. It's a really hard thing to talk about. And often we leave our doctor's offices feeling a bit like shit, like we don't know how to do the thing that they're telling us to do. We don't have the tools to do it. And even if we do it, sometimes it reverts and we put more weight back on. It's frustrating, it's difficult, and people are judging us for it. It's a really hard thing to talk about. We're going to talk about weight in a way that we hope is respectful and in a way that we hope you understand we're meaning this in a way that is literally just because we know it impacts our health. So weight where we're talking about too much, not enough, the ways we choose to lose it or gain it and the impacts that it has on both our physical and mental health, because this is a really important conversation.
It is, yeah.
Later, though, we'll be checking in with Tamsin for today's quick consult. She keeps getting the same issue with her eye. Stacks of us get it. She says hers are worse than anyone else that she has ever seen, and she wants to know how to stop it from happening again. But first, I don't know about you, Mariam. I'm super obsessed with historical medical things.
Yep.
And when you look at how we dealt with women's health in the past, it's unhinged. It's time to head to med school.
Welcome to med school.
Okay, this picture was posted on Dr. Lindsay Fitzharris's Instagram account recently. She's a medical historian, which I think is an incredible job to have. It's of a speculum.
Oh, that was huge.
It was ginormous. And if you don't know what a speculum is, it's a tool that doctors use to be able to inspect your cervix.
Yes.
Correct? Mm-hmm. Sometimes it's metal, and I've had doctors warm it up a little before they go in. More often than not now, it's made of some kind of medical grade plastic, but it always looks a bit like a duck bill.
Yep.
I'm doing a hand gesture. Exactly that. But this one in particular that she posted, it looks like two soccer shin guards made out of metal.
I don't know what that is.
That was hectic. And it's attached to like a set of forceps.
I have no idea what that looks like machinery.
It does look like, it looks like it's made out of steel or iron or
something you put on a horse or something.
That in itself is quite the leg crosser, let's be honest. But it was a story that accompanied that picture that really got my attention, because this speculum in particular was used to help deliver leeches to the cervix.
Okay. Tell me more.
Apparently back in the 1800s, it was a very popular treatment for a lot of gynaecological issues, because if we think men did not understand women's health now, let's just say they less understood things back in the 1800s, although men did invent the vibrator through medical purposes. So maybe they understood a little something. But the idea of leeches was to remove excess blood, which doctors at the time thought caused a whole range of things, from cervical tumours and inflammation and things like that. And in fact, by 1830, leech treatment was so popular in Europe, and I don't just mean on the cervix, they used it for a lot of different things. There was a leech shortage, which is something we would not consider in today's medical world. But a fun fact, leeches are still used today.
Yes.
They come from leech breeders. They don't just pluck them out of your local dam, which is where I've come across leeches in the past. There's a medicinal leech farm on the border of Victoria and New South Wales, just near Echuca. But Mariam, use a lot of leeches in your daily practice these days?
No, definitely not. But they are still used for medical purposes, only in very specific hospital settings, mainly in plastic and reconstructive surgery. So they're helpful after surgeries like finger reattachments or skin grafts. Basically, after these operations, blood flows in, but it struggles to get out. So you get a bit of that venous congestion. And leeches help by drawing out that excess blood. They also release a natural blood thinner, which improves circulation and gives veins time to recover after those surgeries. So they're used under strict medical supervision. Patients are often given antibiotics prophylactically to prevent infections, and they're discarded after use. So obviously not reused.
Oh, so you don't get a used leech when you go in and get leech surgery?
Yeah.
Thank you, Mariam. It's time to get into today's checkup.
It's time for the checkup.
I am going to attempt to stay emotionally stable during this conversation because I find weight really difficult to talk about. I know many of us are in the same boat. We've had lots of run-ins with our GPs over the years who have either brought up our weight when it's completely unrelated to the thing that we have gone in for and it feels very confrontational, or we've tried to get help with it and they've kind of said, losing weight will help fix pretty much everything that's going on with you, but you don't really get given the tools to do it. And so you try and do it yourself, and there's a billion things online that you can look at that tells you this will help you lose weight. And sometimes it works, but then you put that weight back on again and then some, or it doesn't work at all and you get so disillusioned. And for those of us who rely on food to kind of comfort us in those times of feeling low, you then compound the problem. So we are obviously too very well aware that there is weight loss injections out on the scene now, which is really changing the narrative. And we will be talking about that in next week's episode on this in a whole bunch of detail because there's a lot to talk about around weight loss injections. But more often than not, you leave your doctor's office, you feel like shit. You question how good a human being you are because you're like, why can't I just not be fat? Why can't I fix this? But Marion, first up, I think I would like to ask you how you discuss weight with your patients because, I've spoken to you personally and I relayed a story at an event recently where doctors have spoken to me about my weight and it's been really awful. How do you discuss this with your patients?
This is, I think, something that a lot of doctors in the healthcare space really need to reflect on, and I'm really sorry for experiences. And I've had many patients who come to me and tell me of awful encounters they've had with healthcare professionals. When it comes to discussing weight, I always try to approach it with empathy, curiosity, and zero judgment. And I think that's really, really important. And I know that for many people, having conversations about weight has been laced with blame, shame, and it's felt overly clinical and you've just been dismissed. Lose 20 kilos, like you've said, and go out on your way and figure it out on your own. As a GP, my role isn't to lecture you. It's to listen, to understand your experience and support your health goals and make sure that we facilitate that as well, have that ongoing review and that support system in place. I try to shift the focus away from numbers on the scale and look at the broader context. We know that weight is just more than numbers. It's your mental health, your relationship with food, hormonal metabolic issues which may be at play, lifestyle, and the impact of things like sleep and stress or past trauma that can all influence your weight. Weight is complex and it's not just about willpower, and I will never make it seem like it's simply just eat less and move more and you'll be fine. If we do talk about weight, it's with your permission and with your agenda in mind, and it's never as the first or only topic. So if you've had negative experiences with your past GPs, I see you and I apologize. You deserve to be treated with respect and compassion regardless of your body size, and we're all in this together.
Oh, I wish I could send you off to a few of my past GPs to have that conversation. But I think when we talk about whether you can be healthy at any size, we need to have a conversation about how weight actually impacts our overall health.
Yep.
And of course, that's not just an issue for those who are considered to be overweight. Being underweight also comes with its own list of issues.
That's right.
So what should we consider when we talk about weight impacting our health?
We know that weight can influence many aspects of your health, whether you're overweight or underweight. So carrying excess weight is associated with increased risks of several medical complications. So your cardiovascular system, for instance, we know increases your risk of coronary artery disease, high blood pressure, stroke, metabolic conditions like polycystic ovarian syndrome and type 2 diabetes, fatty liver disease, certain cancers, respiratory conditions like sleep apnea or asthma. And then there's the musculoskeletal problems. So you might have chronic lower back pain and osteoarthritis. There's also reproductive health concerns. So a lot of people might have irregular periods, absent periods, troubles trying to conceive, or issues during the pregnancy. And then let's not forget, importantly, the mental health challenges associated with being overweight. There's depression, anxiety, and there's that reduced quality of life as well. But being underweight can also have health implications, and that includes nutritional deficiencies. So we see things like fatigue, hair loss, brittle nails as, telltale signs. They have a weakened immune system, so they're more prone to infections. They may also have delayed wound healing as well. There's also bone health concerns, so osteopenia, which is the step before osteoporosis or even osteoporosis. Again, these people also have reproductive issues as well, irregular absent periods as well, and mental health conditions as well, and that includes anxiety, depression, and unfortunately eating disorders as well.
We've been told the BMI is not a great measure for assessing our risk of certain health problems, and that's because the BMI was never designed to be used on an individual basis. Now I'm seeing a ton of people in my social media feeds saying that it's your hip to waist ratio, which is what we should be using to actually assess whether weight is an issue for us. Do you think that's a better way to work it out?
So you're absolutely right. BMI has its limitations, and we're definitely shifting to more nuanced ways of assessing health. So the BMI is a simple formula, weight over your height squared. And it works well at a population level, not at an individual level, because it falls short. It doesn't take things into account like your muscle mass, your age, your fat distribution, your ethnicity,
oh my
your
God,
genetics.
my Islander friends are like, BMI, I don't think so.
Exactly. Yeah. So a muscular person or someone who's Pacific Islander may be classified as overweight, but they're actually healthy. So it's a useful starting point, especially when assessing people in the overweight or obesity range, because we know a BMI above 30 is linked to an increased risk of complications like cardiovascular disease and type 2 diabetes and heart disease and sleep apnea, for example. The good news is that a good GP will understand that it has limitations, and we will use it alongside things like waist circumference or that waist to hip ratio. These give us an idea of a better understanding of visceral fat, and that's the fat, the kind of central fat that's around your organs, and that is linked to cardiovascular disease, insulin resistance, and metabolic issues. So even people with a normal BMI can be at increased risk if they carry this extra visceral fat as well. So yeah, your health isn't defined by a single number. There's a complex interplay of things that we need to consider. Genetics, environment, those ratios might be helpful as well. And I think GPs are doing a good job at working towards a more holistic and compassionate approach. Well, I hope so anyway.
Yeah, we don't want a doctor bash here,
No.
But how do we talk to our GPs about this? And I want to say too, don't be scared to call your GP out if they do it wrong, because I've had, just as an example, recently I told my GP that I was struggling to fit exercise into my daily routine. And he said to me, this makes me laugh even thinking about it. He said to me that he commutes 6 hours a day, runs a GP clinic and still is able to go to the gym. And I said to him, so do you have children? And he said, yes, I have 2. And I said, and you have a wife, I presume? And he goes, yeah. And he goes, I said to him, who is taking care of your home, your children, your life, your admin, everything else, your extended family? Who's taking care of that when you're commuting and GPing and going to the gym? And he goes, oh, well, my wife. And I looked at him and said, I'm the wife. And he went,
It's been like a jaw drop moment.
yeah. And he went,
mic drop.
oh, and then at the end of that consultation, he said, I'm really sorry I did that. And I was like, thank you.
Good on you for calling it out.
But how do you speak to your GP when you are really worried and stressed about talking about your weight?
Yeah, look, you're allowed to have boundaries in that space, and I think that's really important. But I think if you want to go to the GP to discuss your weight, maybe bring a support person with you if it's something that you feel a bit more confident about, and just frame the question like I've written a few, which I think is a good way to say it. I'd like to talk about this, but I need it to be a supportive conversation. Can we focus on health and habits, not just my weight? I've had negative experiences in the past and I want this to feel different. I want your support. So I think framing it like that is giving the GP the impression like, okay, we're a team here. This needs to be different. I need to support my patient. It's going to be a team effort. And I think that is going to be really impactful for many patients.
I never understood how important that team was until I got a good GP who not only helped me, but also like with correct medications, but also sent me to a physio and a nutritionist.
Yeah.
And like all together we worked
to
make me healthier.
Yeah, and it becomes this team approach and we
Yeah.
celebrate wins together. And, you know, I've had patients come in and tell me like, oh, I'm feeling so much better at the gym. I lasted a class. And it's not just the measurements, it's how they're feeling. They're sleeping better and like they're really excited to share the news with me.
And when you see your numbers, like my insulin levels were like my blood sugar levels are starting to get a bit out of whack. And it's like, this is pre-diabetes.
Yeah.
And when you see those numbers correct themselves, you're like, it is something exciting to celebrate. So,
and you're proud of yourself.
I am.
Yeah,
I am, because finally I've got a team of
Yeah.
people helping me actually achieve something. So hopefully you can find your team too.
And your cheerleaders.
Thank you, Mariam. Coming up, Tamsin has a recurring eye problem that tons of Aussie women get, but it sounds like it should have something to do with pigs. Next, it will make sense, I promise. We speak to endocrinologist Dr Isobelle Smith about our weight set point, whether it's more than calories in and calories out, and whether you can actually be healthy at any body weight, over or under. Weight and our health, as we know, are linked. But how linked? How much will losing weight fix, and how do we even start when we're told to go lose it and improve our lives without knowing more than calories in versus calories out, and an avalanche of social media gurus that claim their way is the way? Endocrinologist Dr Isobelle Smith is here to answer all our questions today, starting with, what is our weight set point all about? You know, when you're overweight and then you lose it and your body's just desperately trying to get back to that point again. We asked her, why do we experience that and what can we do about it?
So the theory you're talking about is kind of a weight set point. And it's a theory that our body will always kind of go back to our rough weight set point. In reality, it's more of a weight range. And when we lose weight, it's very hard to make a new lower weight set point. Versus when we gain weight, often the theory is that that's our new set point. And there's definitely science to back up that this has a lot of truth. We know after weight loss, our hormones that control our appetite, such as ghrelin, and the hormones that make us feel satisfied, such as leptin, will change in a way to make us hungrier and want to eat more and try and get back to that weight. Really, it's only been in the last few hundred years that food hasn't been scarce and our biology hasn't changed to this environment where there's an abundance of high calorie foods. So that weight set point has really previously been an important survival mechanism, but now is part of why people find it hard to maintain weight once it's lost. And we do have, increasing obesity and overweight in Australia.
With the body positivity movement, which is so important because we want to make it clear that being a bigger body is nothing to be ashamed of, right? But there is a question that we attach to that too, and that is, can you actually be healthy at any weight?
I think this is a great question. It really shows that two things can be true at the same time. We know that we live in a fat-phobic society. We know that there is a lot of stigma, even in the medical profession, regarding obesity and putting everyone's issues and complaints down to their weight. And we know that people with obesity often have serious issues dismissed. And at the same time, we also know carrying extra weight can increase the risk of, many conditions, such as things like diabetes, heart disease, even some cancers. So those things can both be true at the same time, and actually addressing both of them are mutually beneficial. We know shaming people does not help improve their health. And I think there's a lot of benefits in the body positivity movement. And can we be healthy at any weight? Yes, we have a new term now. We're kind of replacing the BMI of talking about clinical versus pre-clinical obesity. So someone might weigh more, but if they've got good cholesterol, they don't have diabetes, they exercise regularly, they're much healthier than someone who may be slimmer if they don't have those things. And really one of the biggest determinants of our overall health is actually how physically active we are. And that helps us predict someone's health outcomes much more than weight. You can, of course, be healthy at a bigger body. However, having a bigger body, especially carrying extra weight around the middle, does increase risk of certain conditions.
I'm really interested to know your answer to this because there's a lot more conversation around viewing things like weight as more of a hormonal issue than a calories in, calories out thing, right? So should we be thinking about obesity like a hormonal issue instead?
I think social media has really made popular this idea that kind of calories in, calories out isn't true. And to some degree, calories in versus calories out is what weight loss and weight is about. We cannot defy the laws of thermodynamics. They've done studies putting people on very low calorie, high carb or high fat diets, and it doesn't actually matter the kind of macronutrients. It's about the total caloric intake. However, for some people, calories in, calories out is very, very complicated. So that means, yes, hormonal factors can impact how much nutrients we absorb from our food, how much energy we are producing. So, for example, gut hormones. The theory is that people who are prone to obesity and prone to type 2 diabetes, that gut hormone system doesn't work as well. And that's why some people find it much easier to maintain a lower weight, whereas some people struggle a lot at a higher weight. We know after weight loss, multiple hormonal changes occur to try and decrease metabolism, and we decrease our thyroid hormones. We're increasing our stress hormones, cortisol, all of these other hormonal changes, complex, neuroendocrine metabolic changes to try and preserve weight or regain the weight. When I have patients say, I think I've got a hormone problem, can you help me balance my hormones? And I explain, we have over 50 hormones we know about. There would be hundreds more that we don't have tests and we haven't discovered yet. So yes, our weight is strongly influenced by our hormones, but to some degree, it's not a hormonal disorder. It's hormonal adaptations that were likely previously helpful for us to prevent starvation and famines that make it now, again, difficult to maintain weight or maintain weight loss in this new environment we live in.
I'm interested to know how we lose weight if we are unhealthily overweight, but do it in a way that we lose the fat that we are trying to decrease rather than just lose muscle, because we are seeing people who are using weight loss injections and having rapid weight loss losing a lot of muscle mass. How do we make sure that we are downsizing fat and not downsizing our muscles?
I'm really glad you asked that question because I am really concerned about that exact issue. And again, we've seen this in the social media a lot of, are these medications muscle burning drugs? No, they're not. It's just every time people lose weight, they do lose a degree of muscle. And firstly, I would say, if I had a patient come into my room and they're wanting to lose weight, first I'd say, well, let's actually think about why we're losing the weight. Do you have high cholesterol? Do you have fat in the liver? Do you have obstructive sleep apnea? Are there actually any complications of obesity that we're treating? Or is this more cosmetic type weight loss, which who am I to say people should or shouldn't follow cosmetic weight loss? We live in a society that's fat phobic. I would then try and have a therapeutic weight loss goal of saying, if you really lose this amount of weight, we're going to improve your insulin sensitivity. This much, we're going to improve your liver. This much, we might improve your arthritic pain. So have a reason for why the weight loss is, and then talking about healthy weight loss. We know anytime people lose weight, they lose some muscle, but the integral factors are eating enough protein and doing strength training. There was this beautiful study where people lost 9 kilograms over 6 months, and they compared the lean muscle mass of people who were doing either all strength training, all aerobic training, or a mix. And the people who were doing weight training had far less muscle mass loss. And then if we add in making sure people are getting enough protein, and that's again why I do worry with some of these medications when people are going to some online doctor, never seeing them again, getting a really high dose that they've got no appetite, so they're hardly eating. Their dietary protein intake is, way low, and that's further causing that muscle loss. And with that muscle loss, if they then regain the weight, they're not regaining muscle, they're mainly regaining fat. So I've had patients where I see you've actually become more insulin resistant, worse cholesterol, or your health is actually worse from going on these medications. So for me, my patients need to have 1.5 grams of protein per kilogram and be doing weight training twice a week.
How do I set a realistic target for myself when I don't have a lot of resources? Because sometimes we know that shifting your diet is great if you've got a lot of money to spend on fresh food. How do I then work to make sure that I'm setting a realistic goal with the resources that I have access to?
I would actually try and swap the narrative and say, I want to have a health focus. And so that's not the question you asked, but for a lot of patients who have been struggling with their weight for years and years, it becomes such a negative association with weight loss. And I want lifestyle changes to be a positive thing. I want people to feel like they're adding to their life, and I want to activate the reward part of their brain rather than the punishment part of their brain when we implement these healthy lifestyle changes. So I would actually say, let's not worry about the weight loss. It is one part of your health, but let's actually focus on how we can get more veggies into your life. Let's see how we can focus on getting more movement. Let's try and add more water and less sugary drinks, because all of those things are going to improve your health. And I don't like weight targets. I think it's a bit, silly. We're just picking an arbitrary number. So I'd actually flip the narrative, say, let's focus on health-related behaviors and then see what happens with weight.
Thank you so much, Dr. Smith. Miriam, I really love the language that she uses when we're talking about this. She says if you get obesity, if you get overweight, it's not when you are overweight, when you are obese. She's talking about it like it's an actual medical condition.
Yeah, and that's huge. It frames it as something you have, not who you are. And as a GP, that shift is so important, especially given the stigma people carry already with how they feel about their weight. I think she explained the biology really well too, like things like the weight set point and how hormones fight against weight loss. Isn't that insane?
It's so upsetting that my body is actively trying to stop me from achieving what it is I'm to be, like, trying to be healthy.
It's not just about willpower. It's about your body doing its job to survive.
Because it's expecting famine, right? Like, stock up, get in there, girl. You'll be able to outlive them all.
So less blame, more science and more support.
Yeah, love that. Next, it's quick consult time, and Tamsin's written in because she has a rhyming problem with her eye. And while it goes away eventually, it just bloody keeps coming back. We'll get to your question next, Tamsin.
The doctor will see you now just through here to consult room 1.
It's time to answer a question from you, and thank you to all of you who've been sending in all the weird and wild things that your bodies are up to. We've been getting a stack of DMs on our Instagram account, which I've been chatting with people over. It is so fun to find out what is happening to you.
No pictures of rashes.
Not yet, but like I'm open. Just like keep it PG. You can do it too. There's an email to well@mamamia.com.au, or you can remain anonymous. There's a link in our show notes that shows you exactly how to get into the waiting room. All right, quick consult time. Miriam, today Tamsin has an eye issue, which is absolutely not fun.
I keep getting styes in my eyes. The last one was massive and it made my whole eyelid puff up with a huge red bump in the middle. I've been told a stack of things to try and fix it, like hot compresses, tea tree wipes, and colloidal silver, but how do I actually stop them from coming back? I'm so over it. They look awful and they hurt so bad.
Thank you, Tamsin. I've had one too. They're so scratchy and itchy and puffy and hot and gross.
Yeah.
What does she do?
Okay, so I'll start by explaining what a stye is. So it's basically a small red, can be large, painful lump on the edge of your eyelid. It's kind of similar to a pimple, and it happens when the oil gland near the lashes gets blocked and infected. It's usually caused by a bug called Staph aureus. After a few days, it may drain and then the pus might kind of find its way out.
What a great word.
Not to be confused with a car lesion. They look similar but aren't caused by infection, and that's essentially due to blockage of the oil gland. They're less painful but can last longer and form a firm bump in the eye, and they can just sit around for a while, which is really annoying. So people that get recurrent styes, they're often caused by blocked oil glands from leftover makeup or poor eyelid hygiene. So if you're not washing off the makeup before bed or giving, the face that cleanser that it needs every now and again.
Does that also include like cleaning your brushes? Because I'm very bad at doing that.
And it's also, some people like have had mascara for a really long time.
Oh, God, I'm bad with that too.
I think these things have expiration dates as well. Or they might have tried a new product, or they've just left the mascara on and haven't really washed it off. Mm-hmm. So whenever I see patients with recurrent styes, that's a big part of it, is like the mascara brushes.
I feel so bad chucking out like mascara that still has usable mascara in it. It feels very wasteful.
Then we'll say hello to your styes every now and again. You choose. Other causes for recurrent styes include blepharitis, which is like this chronic eyelid inflammation. You might have skin conditions like rosacea or dermatitis. Or if you're one of those people like me where you continually touch your eyes and rub them. Oh. Yeah, especially if you've got unclean hands. So what can you do to prevent recurrence? So I know she's tried the warm compressors, but most people don't do them properly. So you're meant to be doing them for about 5 to 10 minutes, not 1 minute. And you're meant to be doing them multiple times a day. You really want to kind of open up that gland to get it to drain. And that helps, prevent any buildup or anything like that. You want to clean your eyelids. So you can get those baby wipes from the chemist, or you can get some baby shampoo, dilute it with water, and then get those eye wipes and just give it a nice clean. Replace old makeup, like we've mentioned. Manage any underlying skin conditions if you have those conditions we mentioned. And if they're not going away, then we will refer you to an ophthalmologist, which is an eye specialist. They can drain persistent or recurrent styes,
of the pus.
Yeah. You should YouTube or TikTok those surgeries. They're pretty cool.
Oh my gosh.
Yeah.
You have if you ever get a chance to look at the videos that Mariam looks at, it's very different to the videos that I look at on TikTok. I'll tell you that much. She likes to get into people's bits.
Yeah, I love it.
Thank you, Tamsin. That is such a good question. And as we all go back and assess our makeup bags today for any potential infectious diseases, just chuck out the old stuff.
And buy some new stuff. That's an excuse.
That
so
is
the
an
doctor's
excuse.
Telling you to buy some new makeup.
That is well for today. Don't forget, if you do have questions, we have an email address. It's well@mamamia.com.au, or leave us a voice note. Next week, we are getting into those weight loss injections. Are they the saviour that everyone says they are, or are we setting ourselves up for disaster? It depends on who you ask. And if you want more info, we can arrange that too. We can have it sent right to your inbox. In fact, sign up to the Well newsletter. There's a link to that in our show notes. Remember, the advice you've heard here today is general and may not suit your exact needs, so make sure you speak to your own doctor or health specialist to get the info that's right for you. And Mariam, we'll see you for your appointment this time next week.
Bye-bye.
Well is produced by me, Claire Murphy, our group executive producer, Georgie Page, and senior producer, Sasha Tannock, with audio production by Scott Stronach.
Mamamia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.
Hi, I'm obstetrician Dr Patrick Maloney.
And I'm Bridget Maloney. We're the hosts of The Kick, the pregnancy podcast that breaks down everything you need to know about making and growing a tiny human.
We cover it all with expert information and evidence-based discussion based on our experience of running a women's clinic and being parents to 4 boys.
From morning sickness to birth plans, strange cravings to baby movements, listen to The Kick wherever you get your podcasts.